Good morning, doctors. Welcome again. As you all know very well that we already discussed syphilis lecture in English language or in Hindi language both. So after that I decide to put some MCQs regarding syphilis. Which of the following may be a sign of primary syphilis? In primary syphilis, as I told earlier, that it's a painless sore in genital area or mouth or mucous cavities, or we can say it's a chancre, painless chancre. Okay. Now let's discuss. A primary syphilis infection may present as a symptoms of painless sore, we know as chancre, which is usually within genital area. In some circumstances, the sore may exist on another areas or may not easily visible due to its location being inside the body. This sore always extremely contagious and will go away with time. As I told, it disappears if we are not going to treat, then also automatically. But it converts into secondary. Okay, now which of the following is not a typical symptom of secondary stage of syphilis? Swollen glands, muscle and joint pain, dry eyes, rashes on the feet and hands. But dry eyes were not seen on secondary syphilis. When primary syphilis is remain untreated after a year, the secondary syphilis is developed. Okay. Now, secondary syphilis can produce a symptoms such as the following like patchy hair loss, rash on the soles of the feet and the palms of hand, or elsewhere on the body, fever, swollen glands, muscles, and joint pain. Okay, now dry eyes are not seen. True or false? If your partner does not have a visible syphilis sore, you are no risk of infection. This is false. If he is suffering from syphilis, then you are always be at a risk of suffering from syphilis after doing intercourse. So, syphilis sores may be located in areas where are not clearly visible. Example inside the anus. Also, when the sore goes away, syphilis progresses to into secondary syphilis. As I told, the individual remains infectious despite having no visible sore. Okay. Now, how is a person tested for syphilis? It is mainly by blood test, as I already told that trypanosome and non-trypanosome test, VDRL test and RPR test or TPHA test or FTA ABS test. Syphilis is tested through a simple blood test. Remember now. True or false, being tested for syphilis is a part of routine health checkup? No, syphilis is not a part of routine health checkup. Okay. Syphilis testing is not done during routine checkup unless specifically requested by the individual. Syphilis testing is, however, a routine STI testing conducted by both of Calgary STD clinics or safe workers. Okay. Now, true or false? Using condoms, dental gums, gloves during intercourse guarantees that syphilis will not be transmitted. No, there is no such guarantee after using uh, condoms with infected female. You are not going to suffer from this, but it is not useful. It can be not 100, it is useful but not 100% protected. Using these tools does significantly reduce the risk of involved, but because syphilis sores can be located on the outside of the body, the skin-skin contact that may occur when with these tools creates a situation where it is still possible for syphilis to be transmitted. Okay, now true or false? Syphilis can be very serious for a pregnant mother. Yes, it is very serious. It's true statement. Let's discuss why. Syphilis can easily be transmitted to the infant during pregnancy or less commonly during birth. Congenital syphilis can be result in significant health problems of infant including skin lesion, disseminated infection, infection throughout the body, enlarged liver, spleen, infection in the brain, and even death it can lead. So, guys, as we know, syphilis is two types: acquired or congenital. Acquired syphilis is by sexual contact or performing a intercourse with unhealthy, with infected person with a normal person, then they transmit. But congenital is from mother to fetus by the route of placenta, because syphilis treponema pallidum can cross the placenta, which causes syphilis in congenitally in a fetus. That is very, very dangerous for a small child. That's why in ANC, this is a routine checkup of VDRL, HIV, hepatitis B to C. Okay. True or false? Although syphilis is still a problem, we have fortunately been seeing declines in number of infectious over the last 6 years. Yes, between 2002 and 2007, there has been a steady increase in number of syphilis cases in Alberta, and problem is still presenting. So, hope this answer is false. So, guys, have a good day. Goodbye. That's all for today. And I hope it's clear for you till here about syphilis. So, guys, there is no use if you are not studying the theory of about syphilis. So, please go through there and read the theory, which I already put in dual languages, in Hindi language and in English language. If you are going to see in English language, there are some photographs very much interesting. And if you see Hindi language, then I myself explain in Hindi about syphilis. So you can watch both lectures, and hope this will clear you all your ideas. And if you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it. Thank you. Good day and goodbye. That's all for today.